Welcome to ParaMOOC 2020. This year's course is called Parapsychology Research and Education, and our special topic this year is psychology and parapsychology, which is obviously something that's dear to our hearts. I like to show our course logo, which is a Wordle put together by Radiant Skies, the artist Radiant Skies, and licensed from 123rf.com. And this is our faculty this year. We've got Andrea Summer, who's going to close out our course for us at the end of February, which gives us a free day on Sunday. We're not sure if we're going to fill next Sunday. This is Everton Moraldi, Cal Cooper, Christine Simmons-Moore, Jim Tucker, Claudine Massacote, who will be here next week, Renaud Evrard, Ethel Cardania, and Brian Williams, who's in the class today. And of course, the big guy, Carlos Alvarado, and his new book. So he will be on in a minute. And I just wanted to mention that Parapsychology Foundation, and we want to say thanks as always to the Parapsychology Foundation for its past and present support of the ParaMOOC series. And this is the logo of Carlos's and my virtual education project, the Alvarado Zingroni Institute for Research and Education. I'm sorry we didn't make this up. It was Natasha's idea, and she talked us into it, and we couldn't be happier. The Azire teaches on sponsors Jim Matlock's Signs of Reincarnation course on our Moodle. We teach on WizIQ. We also teach in Second Life when the Azire Library and Learning Center is actually up, which hopefully will be next week sometime. So today we have Dr. Carlos S. Alvarado, co-director of the Azire, the founder of Alvarado Zingroni and Associates. He's a research fellow at the Parapsychology Foundation, and today's talk will be called Parapsychology and Psychology, an Introduction. So here's his biography. Carlos has a Ph.D. in psychology from the University of Edinburgh, holds master's degrees in parapsychology. That one is from John F. Kennedy University, and in history, that's his second master's, and that was from Duke University, with a specialty in history of science. His work has centered on studies about the history of psychical research and on survey research on out-of-body experiences and other psychic experiences. Alvarado is a research fellow at the Parapsychology Foundation, as I mentioned. He's an adjunct research faculty at Sofia University, formerly the Institute of Transpersonal Psychology, and it might be Sofia University. And he is the recipient of the 2017 Parapsychological Association's Outstanding Career Award. He's is one of the editors of Research in Parapsychology 1993, and the author of the newly published, as of December 18th, Charles Richet, a Nobel Prize winning scientist's explorations of psychic phenomena, that was put out by White Crow Books, as I said, in 2019 in December. And if anybody is looking for a publisher, these guys, John Beecher, is so easy to work with. We had a wonderful time working with him on this manuscript. Carlos has also published over 340 articles in psychology, psychiatry, and parapsychology journals, and in a number of more informal articles as well in magazines and online sites, and of course his very frequent blog, Parapsychology News, History, and Research. I may have those words turned around, but you'll be able to find that in his fuller biography. So the presentation today summarizes aspects of the relationship between parapsychology and psychology. In addition to a common history with psychology, it is argued that parapsychological phenomena are psychological phenomena and part of the realm of psychology. This is supported by the results of experimental and survey research relating ESP and other phenomena to personality and cognitive variables. In addition, parapsychology has implications for various psychological topics. Examples include the study of the variety of human experience, concerns arising from clinical practice, attitude and belief change, individual differences, and the expansion of human potential.
Okay, today I'm just going to present a very general introduction to the rest of the lectures, the whole argument being specific examples of the relationship between psychology and parapsychology. In the next lectures, you will basically get much more detail about all the aspects that I will be discussing, like experimental research, clinical concerns, and a little about history, theory, and many other things. So these are the topics that I will discuss. First, the psychological aspects of or psychic phenomena. Some aspects of the common history of the field, some theoretical issues that are purely psychological. And finally, and I think very important, is the things in which I believe that parapsychology has and is still contributing to psychology. That's something that needs to be kept in mind, that parapsychology research is enriching psychology in many ways. Even through critics of the field don't discuss these things frequently, I think it's a reality and it needs to be acknowledged. Let me start a little with some aspects of common history, which is, both fields developed in the 19th century. Psychology, of course, was ahead developing and had a much higher level of development, such as institutions and degrees, people involved in different countries, and so forth. One of the things that united both fields, psychology and parapsychology, was the concept of the unconscious mind, that traditionally is discussed in terms of clinical developments, such as you see here in these slides. We see the work of Charcot in France with hysteria. This is a very famous picture of Charcot working in Paris with one of his famous hysterics. And this is the type of thing that they will do at the time. He will present what they used to call the Tuesday lessons. In the Tuesday lessons, Charcot will just stand up and talk about a specific patient. In this case, this is a woman that is on his left hand. This is the famous Blanche Whitman. And discuss her symptoms and her phenomena and so forth. And in front of a group of people. Some of the lectures that he presented were for the general public, so almost anyone could go in, and it became a big social event. Others, like in the case you see here illustrated, what we see is the only physicians and very selected individuals that work with mental phenomena at the time. The specialty was hysteria, and hysteria at the time was a blanket, very big diagnosis that included all kinds of things, from sensory to motor behavior, paralysis and blindness, just plain misbehaving, and anything that a woman will produce that they wanted to label as hysteria was a hysterical symptom. And that was one of the things they were criticized for. But this is a general context that develops, that helps the development of ideas of mental illness and of the unconscious. Even if Charcot himself was not that big in talking about the unconscious as a region of the mind, he certainly wrote a little about it and acknowledged it. But when I'm using this more as a general paradigm that was available at that time in mental medicine to emphasize the study of unusual phenomena. Certainly, the idea of the unconscious mind developed independent of hysteria and other phenomena. You get here a lot of different theoreticians, Freud being the best known one. And we will see later that Freud was also involved in psychic phenomena, particularly cases of telepathy during psychoanalysis. But here is just to make the point that another common aspect of psychology and psychical research was ideas about the unconscious mind, and I will get to the psychical research side in a moment. One phenomena that really brought both fields together was the study of mediumship. On one hand, there were psychical researchers trying to document different mediums, but at the time, especially starting from the 1870s on, several physicians or psychiatrists, we will call them today, started paying attention to mediumship, not always in a positive way, but the whole idea was that they were seeing the medium as an individual that could provide information about the human mind and the unconscious in particular. So here you have some initial ideas about dissociation that were developed basically because of mediumship. So it was not only the psychical researchers, but a lot of big figures in psychology and psychiatry that were interested in this. Many of them believed that mediumship was pathological. And here you have the famous Ph.D. He was a French worker in the unconscious, a very important individual in the history of the concept of dissociation, that the mind can really split and separate perception. So you can separate physical sensations and particularly memories from consciousness. And that later on, and at the time, Janel connected that with traumatic experiences. He basically argued that mediumship was a dissociative phenomenon and was pathological. So as you can see here in the quote, he said that mediums are neuropaths when they are not frankly hysterics. And many individuals, particularly in France was very strong in the study of psychopathology and speculation about the pathology of mediumship. There were other individuals that made a connection between pathology and real mediumistic phenomena. And that's the case you have here of Cesare Lombroso, an Italian psychiatrist and criminologist that believe that mediums produce real phenomena. You know, they produce real veridical information, real physical phenomena like table levitations and the like. He studied the medium Eusapia Palladino, but he still believed that these mediums had pathology, that they were hysterical or with some other nervous pathology, and that it was just a combination of an abnormal state of the nervous system and real psychic phenomena. So I'm presenting this here basically to bring together how the whole field of mediumship brought together ideas from the study of the mind and emphasize just different aspects. Again, that's part of the common history of psychical research and psychology. Interest in the unconscious was really big in the Society for Psychical Research. In, for example, the work of Frederick Myers, pictured here, was extremely important. But he was highly influential, particularly in England. In France and other places, his work was known, but he was not as influential as he was in England. And of course, he came to the United States, the ideas as well. Partly may have been a language issue, but he influenced many individuals in the idea that not only the unconscious, which he called the subliminal mind, but his whole idea was that the subliminal mind was a really vast area that was related not only to things like creativity and dreams and hysteria, but also to mediumship, to telepathy, to what today we will call the paranormal or the parapsychological. So his model basically expanded the whole concept of the unconscious that existed before him to include a lot of other phenomena. And of course, spiritual aspects as well. You know, he basically ended arguing that psychic phenomena, like things like telepathy, were not meant to be used in this our physical life here, but basically were faculties that we had that were basically spiritual and will be used later when we left this material plane, basically when we die. And but that was only one aspect of his things. In developing this idea, he really made a whole canvas of the whole field of mental medicine and psychology, and gave us a very strong picture of the unity between psychology and psychical research. That was, of course, not accepted by a lot of skeptics at the time. These ideas of unconscious and dissociation were not related, of course, only to psychic phenomena. I have put here many different aspects that affected the development of these ideas, especially in the 19th century, and consequently affected the development of psychology, such as a variety of other phenomena, such as hypnosis, somnambulism, a lot of physiological ideas about the mind. The fields of psychiatry and psychology were becoming more professional. So it was not only a hobby that some people had, but there were people that were studying to become psychologists, to become psychiatrists. And that, of course, that's a process that took a long time. The development of institutions, by that I mean psychology at the universities or private research institutes. The holding of congresses, the development of psychotherapy was another important aspect. There were many things that affected the development of all of these ideas and affected psychical research as well. But the point I'm trying to make is that we have to be careful and not say that psychical research was the only aspect involved in developing the ideas of the unconscious and dissociation. It was a very complex process involving many different variables. There was a lot of contact between psychical research and psychology in the international congresses of psychology. That's what's illustrated in this slide. These were congresses that started bringing together practitioners of psychology, and at that time that meant mainly physicians and psychologists, but there were also psychical researchers and a few other people. Started in 1889, and there were a variety of different congresses in different places, first in Paris, then in London, then in Munich, and then they went to other countries afterwards. At first, psychical research was admitted at the congresses, but slowly a process of resistance started coming out, and eventually, and it was an unfortunate thing, psychical research ended being rejected from the Congress. In 1900, they go back to Paris, and at that Congress, there is a lot of vocal protest. A lot of the people that were present were protesting the inclusion of topics like mediumship, like telepathy, and so forth. And one thing that you can do that I have done is basically get all the proceedings of these conferences, and you see a clear decline from the 1889 Congress as the years go by after 1900, and the papers about psychic phenomena like mediumship, telepathy start being less and less and less. By about 1910 or something like that, they disappear completely, and psychology continues developing without having psychical research inside it. That's part of this, the history of the psychologist's rejection of psychical research. And what I present here are several references of people that have discussed that. There were many attempts by psychologists not only to criticize psychical research, which is something that continues to this day, but basically put psychical research outside of psychology. And that's something that we still see today in different ways. I'd like to remind you that in the presentation of Andrea Sommer that has been rescheduled You will get details later when he will present. He gets into a lot of these issues of acceptance and rejection. That was his doctoral dissertation work. And in this case, he will talk to us about William James and psychical research in the United States, and the case of Leonora Piper, which was a very well-known and influential mental medium that got involved with the best people in psychical research at the time. Andreas is going to discuss a lot of these issues, and this is a presentation that you should not miss. Let me say something about research. A lot of parapsychological research is also psychological in nature, because what we're trying to see is how ESP and other phenomena relate to psychological variables in general. I mean, that's kind of common and well known, but a lot of people tend to forget it and try to put parapsychology as a very different field from psychology. And that's not necessarily true. One of the things that we get from ESP in the laboratory, and these are some illustrations of Ganso ESP research conducted in Brazil, is the way people responded or elicited ESP. You know, in most tests, you get a verbal response. You know, people say something that comes to mind. They produce written responses, or more or less automatic ways, like if you have a machine that you have to press a button or push a level or do something like that. That will be a different response. But there is another type of testing which is looking for unconscious responses. That is people that are performing tasks and they do not know that they're in an ESP test. But the idea is that if you are answering a questionnaire and maybe you need some ESP information to answer it correctly, that perhaps evidence can be found that at some point your guesses were correct. And the idea that ESP came in unconsciously to help you complete the answers is what it is at stake. And there's actual evidence that things like this happen, that ESP can act unconsciously and help you in a particular task. That, of course, has big implications in terms of the use of ESP for daily life. If that's what's happening, as some people have said in the past, we're using these abilities or these powers much more frequently than we think that we do. There are also physiological responses, changes in heart rate or in blood pressure or in EEG, electroencephalographic recordings, that correspond at a time that someone in a distant place is concentrating on you. So I see some influence at a distance. Again, that's some of the things that we have learned is how or what types of responses people present, which you consider analogs in the psychological experiment as well. It's basically a human response. One of the things that has been very consistent over the years is the work that Gertrude Schmeidler started, and she started publishing about it in the 1940s. This is a reference to her first paper in 1943, which is the question of the attitude towards ESP. If you believe in ESP, you tend to do better in tests than if you do not believe. So she called the believers sheep and the skeptics gold. And after her, a lot of people have replicated her findings. And as you can see here, there have been some meta-analysis, one by Lawrence in 1993, that found that certainly what Schmeidler was talking about in the 40s, she continued in later years as well, there was evidence supporting that. And even more recently, there is another meta-analysis by Storm and Tresoldi published in 2017 that found similar results. So the whole idea that you have a positive attitude towards ESP affects you, makes you more receptive to ESP. And that's the whole point of all these studies. How is ESP related to other things in psychology that we know characterize human beings? And attitudes is just one example. There has been a lot of work done with all kinds of personality and cognitive variables. For example, extraversion, creativity, and so forth. A lot of this research will be covered, or at least partially, by Christine Simmons Moore in her presentation later, which she calls anomaly proneness. So, I mean, I will not get into much detail, but they have also found that people that have spontaneous psychic experiences do better in the laboratory. Experimental effects, a big topic that started in psychology, being heavily investigated in the 60s and 70s. And we find similar things in ESP testing, that one experimenter tends to be more successful in eliciting results than another. And the speculation is that maybe one person is nicer or has better rapport with the experimental participants. You could argue, many possible explanations. Nobody knows exactly, what it is, but they know that a person can influence the results in ways that we still don't understand exactly, but it's a psychological effect. Altered states of consciousness, and we will later get into that, have also been investigated. ESP during dreams, entering or coming out of sleep, hypnosis, meditation, drugs, sensory deprivation. There is a general body of evidence, as many of you know, that show that this is conducive to ESP. One important thing is to remember that the application of a procedure, like say, or giving someone drugs or giving them suggestions to do better in an ESP test, that doesn't necessarily induce an altered state. That's the importance of always checking in these experiments if you were successful in producing an altered state. And some people have done it through questions, asking the person afterwards how they felt before or after, or they can do it with physiological measurements. But that's a very important thing to be aware of, that a lot of our procedures, even the practice of meditation, they do not guarantee alterations of consciousness. And there is also the issue of the degrees of alterations, very light alterations versus medium high versus very deep alterations of consciousness. And all those things need to be considered in this research. But we are going to have later Etzel Cardeña in one of our lectures in the ParaMOOC is going to be discussing that. Another interesting research is that of different combined variables. And maybe it's not only one psychological variable that is related to ESP, but that there's a conglomerate of variables. And this work, published by Chuck Honiton after he died in 1997, and in his work in the Gansel, he basically found that people that perform better in ESP were the ones that fulfilled this criteria that you see here in these slides, that they had spontaneous eye experiences, that they were high in the feeling perception aspect of the Myers-Briggs, that's a personality test, that had a prior ESP testing experience. That is, they have been experimental subjects before. So they have been in a laboratory setting to be tested before. And that they practice, some type of mental discipline. Usually meditation, but it could be something else, Tai Chi or something different. And this is also very interesting, and it shows the complexity of human beings, just as we know from psychology, that we are very complex beings, always dealing with multivariate processes. The same thing is with ESP. We seem to predict better when we have more psychological aspects that we can measure. Outside of the laboratory, we have also learned a lot in terms of the psychology of the experience. And one of the things is, how does the ESP, for example, manifest in daily life? Loisa Ryan published in 1962 an analysis of over 7,000 different experiences, and she classified according to how that ESP knowledge, or the state in which the person went when the ESP knowledge came through. So dreams, intuitions, and hallucinations were the main categories. The dreams were very interesting, and these similar results have been found before. That what she called literal dreams were 68%. That's out of the 65% of dreams. And those are dreams in which you dream about something, and the ESP aspect is an exact thing of what you dream. So if you dream there was an accident, what happened was that there was an accident in the exact way that the dream showed. That's different from symbolic ones, in which there is not a one-to-one correspondence in the events that happen, but where things that use all kinds of symbols, all types of imagery to represent a problem. So instead of telling you clearly that someone died in one of these dreams, it will present the face of the person that died, or it will present some type of something that will symbolize death. And that has been found over the years to be the case in many of these dreams. But in many of these case collections, we find similar things. There are hallucinations, intuitions, and they can be very dramatic, or they can be very weak experiences, but still they convey what seems to be ESP information. In this case, the Loisa Ryan cases, the advantage is that she had a very high number of cases, but she did not investigate them individually. So there is a possibility of error, that some of these things were not real ESP, but still they are similar to previous attempts of really checking the cases that show similar results. We have learned also about the features of things like out-of-body experiences. This is the results, or the partial results, of a study that by Alvarado and Singroni, published in 2015, of out-of-body experiences in Scotland. Most of these people were from Scotland, and we basically asked them for the features of the OBE, to learn about how this experience manifests and what are the aspects that make the OBE. This is the same thing that you see in studies of dreams, in study of hallucinations, in study of many types of experiences, drug experiences, and so forth, in psychology. We need to learn more about the features of what some people call the phenomenology of these experiences in order to understand them better. So that's what we do also with out-of-body, with near-death experiences, with apparitions, with poltergeist cases, with almost anything you can think. Also with spontaneous experience, and this is mainly survey research, there have been many studies that have related ESP, seeing auras, having out-of-body experience, seeing apparitions, phenomena like that, to these psychological characteristics. Absorption, which is considered by some people a form of dissociation. Absorption is when you lose consciousness of your surroundings and you concentrate your attention almost exclusively to something, and that can be very extreme examples, or just slight alterations, things like fantasy proneness, people with a very rich fantasy life. The concept of transliminality, which is basically a questionnaire measure of what is believed to be the ability of people to communicate with the subconscious mind. People that have a lot of flow between conscious and unconscious. There are some people that have a lot of that. There are some people that have less. There are some people that it's like when you remember a dream. There are people that say, I never remember my dreams. There's a lot of variety, but we have found that high levels of these variables are related to high number of psychic experiences. So again, it's the exploration of how these things relate to psychology, and we still do not understand the nature of these relationships. Why is dissociation related necessarily to ESP or to out-of-body experiences? There are some ideas, there's some theories that I think in the lecture by Christine Simmons, you'll hear some of that. But we still don't know exactly what. But still, there is a clear relationship with psychology. This is another example from my own research with Nancy about auras. Auras is one of those things that parapsychologists don't pay that much attention. So we decided, hey, let's study auras and see if they are similar, there correlates to the results of out-of-body experience research, ESP research, and the like. And we found evidence of relationships, that the more aura experiences people had, the higher they were on dissociation, on absorption, and on several other things, including other parapsychological experiences and dream experiences. By that I mean dream experiences, high dream recall, having very vivid dreams, having lucid dreams. There are people that have a very rich dream life, including people that can manipulate their dreams and the like. And there are others that, as I said before, don't even remember their dreams. Human beings are a study in variety. We have different susceptibilities, different degrees of openness, and so forth. And that's what we have learned from psychology in other phenomena, other contexts. The same thing happens here in parapsychology. Again, there's more evidence of a unity between psychology and parapsychology, which I believe in essence is the same. We're dealing with the human mind. The human mind manifests in different ways, but has also many commonalities. These two are lectures that you will hear in this ParaMOOC, one by Jim Tucker about the psychological aspects of the children that remember previous lives. So here we're getting the phenomenon of reincarnation and of previous lives and trying to relate it to psychological aspects. He will summarize what we have learned so far. There is not a lot of research because very few people are doing that type of work, but there is enough showing that certainly there are some clear findings. Brian Williams will cover a fascinating topic that is mainly a poltergeist phenomenon. And he will also be discussing some of the psychology of the people that have those experiences. Now, that was a very quick overview with not a lot of detail, but I think enough to show that the research has shown, that all different types of psychic experiences are related to the types of things that psychologists study. I would also like to argue now that parapsychology has and is still contributing to psychology in many, many different ways that are things that psychologists are interested in. So as the study of the variety of human experiences, as psychologists, we are all interested in what does it mean to be human? What do we all experience? And a lot of people now in the movement called positive psychology are studying normal daily life things such as happiness. Are you happy or not? And what degree of happiness? Of people that can transcend themselves, people that sacrifice for others. And that's a whole new area in psychology. But traditionally, we have discussed other experience like pathological states of depression, hallucinations, or many other responses to trauma, drug experiences, and so forth. Psychology is full of that. I think parapsychology contributes to enlarge the paradigms of psychology, or at least just the simple statement that there are more experiences that psychologists have not seriously considered. And I'm talking, of course, about ESP, about OBEs, apparitions, and so forth. Here is from a study conducted by Harrelson and Hout Cooper, published in '91. Actually, it's not their own study. They're using data from these companies that have done massive surveys of millions and millions of people in Europe and in the United States about all kinds of different values and ideas. But they included questions about clairvoyance, telepathy, and contact with the dead. And as you can see in the slide here, the reports of the number of these experiences is staggering. Just making the point that everyone that is in parapsychology knows, the psychic experiences are not rare at all. They happen all around us, and they happen in great numbers. It's just that people don't talk about them. They kind of fall in particular niches, and they're put out of what is considered normal. But in reality, they happen all the time and with great frequency. I think that's something that parapsychologists remind psychologists. Oh, it's like knocking at the door of psychology and saying, hello, pay attention to this. There are millions of people having these experiences. And if there are millions of people having these experiences, that means they need to be understood. They need to be studied. They need to be respected as human experiences. Just as people pay a lot of attention to things like schizophrenia, which according to some surveys is no more than 2 to 3% of the general population that are schizophrenic. But the resources that are used to study schizophrenia are amazingly high compared to those used to study psychic experiences. We need to enlarge our conception of what human experiences are all about and the different types. Parapsychology, I think, helps psychology with that. Traditionally, parapsychology or psychical research in the old days was assisting psychology in coming up with conventional psychological explanations of a lot of phenomena. The study of human testimony. If you go to the old classic Phantasms of the Living, published in 1886 by Gurney, Myers, and Podmore, that was the first real major work of the Society for Psychical Research in 19th century England. And they basically collect hundreds of cases of ESP experiences, but they also pay attention to the problems of testimony, errors in observation, narration, and memory. Basically, they contribute into give some normal explanations to some of these experiences. Certainly not all, and they publish a little over 700 experiences that they consider to be unexplained. So it's not that they're explaining away the phenomena, but they're identifying certain problems and certain possible conventional explanations. The study of mediumship with Theodore Flournoy in the book From India to the Planet Mars is an example of the argument of subconscious elaboration and creativity, and how those unconscious faculties, not necessarily parapsychological, can explain some cases of mediumship. Ian Stevenson, psychiatrist well known for his studies of reincarnation, published his fascinating paper in 1983 about cryptomnesia. And cryptomnesia means hidden memory. And it's basically the idea that some experiences, like recollection of previous lives, for example, are related to some unconscious memories that we have and do not necessarily represent ESP or the recollections of a previous life or something psychic or paranormal, but maybe something that we acquire completely normally, things that we heard when we were a child, things that we were exposed subliminally, and so forth. Again, this doesn't explain a lot of the evidence that has been collected, but it's a contribution to conventional psychological explanations. Again, it's a way to help psychology develop their ideas. Clinical issues has been argued for many years, at least since Sigmund Freud, the idea of ESP may help psychoanalysts or other psychotherapies of other orientations, may help them to understand what's happening in therapy. Traditionally, many people like June Eisenberg, Nandor Fodor, Jan Ehrenwald, and others, Emilio Servadio from Italy, they had argued that there were certain things happening in the analytic session, dreams that the patient was having, that sometimes got information about the life of the therapist that were unexplained unless you accepted the idea of ESP. You know, there were two people there working, one trying to help the other, and here ESP seemed to have come into play and be involved in the dynamics of the situation. So some of the dreams had to do with aspects involved in the therapy. Again, the whole thing was much more complicated than previously thought about. And accepting that is helping psychotherapists perhaps understand some dynamics that are not so clear without the idea that ESP can happen. This book picture here, Psychoanalysis and the Occult, is a fascinating place to start studying the older literature. The book was published in the 50s, and it brings writings published in the 1920s, 1930s, 1940s, and which is the basis of all these ideas in psychoanalysis. But similar case may be made on other types of therapy. Remember, psychoanalysis is one particular theoretical orientation in the wider field of psychotherapy. We want to have discussions of the ideas of Freud, and Freud wrote about these things in the presentation by Claudie Massicot, Psychoanalysis and the Occult, A Forgotten History. She will be talking about Sigmund Freud's ideas and the problems around it, and other people that were involved in the early psychoanalytic movement. Some psychoanalysts were very wary that Freud was writing about telepathy and wanted him to tone it down, to get out of the psychic realm, because that could affect the development of psychoanalysis. I suspect that in this presentation that I mentioned, she will address some of that. But then there is also the issue on the clinical aspects of psychopathology. As I mentioned before, the ideas of Pierre Janet in the 19th century about the pathology of mediumship was a very strong movement, particularly in France. But you find examples in the United States, in Germany, in Italy, everywhere. And the whole issue was not only mediumship, but ESP and the like. Is this a normal thing, or are these pathological manifestations? And Renaud Evrard is going to talk about that in this ParaMOOC, in his presentation about clinical aspect. He's a clinician, and he has had many years of experience in dealing with particular cases, and he's also a parapsychologist, so he's certainly open to the idea that real parapsychological processes may be involved in some of these experiences. But again, the whole thing is to take these whole ideas only of the realm of pure psychopathology. Parapsychology is a reminder to psychology that there is more, there can be more. Then the study of personal transformation. For years, psychologists have been involved in studying what happens to people after trauma, after losing someone all kinds of personal changes that we go through our lives. Sometimes just normal changes, like between childhood and adulthood. It's something as simple and as common as that. Psychic experiences have been known to change people wildly. Near-death experiences, there is plenty of research showing that people go through a lot of attitude changes about spiritual issues, their daily life, and the like. This is some data from a study done in Brazil by Fatima Machado, published in 2010 in Portuguese in a psychology journal, an important psychology journal in Sao Paulo, Brazil. And part of what she did was to ask for changes, attitude changes after people have had all kinds of experience, mainly ESP type experiences, but I think there were others as well. And as you can see, there are certain percentages there of people that will say, yeah, that 30% claim that their view of life changed, their sense of being. I assume that means, who they were, how do they feel that they, who they are. They feel there were changes because of these experiences. Again, much more research needs to be done, but it's another contribution to psychology about the factors that affect us, that are not only negative factors. It doesn't have to be traumatic to be a very important life changer. Perhaps more important is the whole issue of the expansion of our human potential. That has for me from the beginnings that I got interested in parapsychology, that was something that I always had in the back of my mind. If these things are real, as I think they are, they're telling us that human beings are much more complex than when we read in the psychology text. I always had that reaction as I was studying psychology when I went to college. I was a young, innocent guy, not knowing much about the world, but I knew about parapsychology at that time. And I could tell that some of my college professors, as learned as they were, they knew nothing about parapsychology. And I always thought that their views were incomplete. Because I was a nice guy, I never told them that, not to their faces. But I always, as I was doing my psychology, I was reading about parapsychology at the time as well in my own time. And I always thought, well, this really, of course, shows a lot more things about our potential. So it's just the whole issue of how can we enlarge the functions of our cognitive processes. Imagine the view that we get from parapsychology is we get all this ESP information and then the phenomenon of psychokinesis, of being able to heal people or to affect machinery or do all this kind of different interactions with the environment. If all these things are real, that shows that we have abilities that have not been recognized that tell us something very important about who we are and maybe who we could be, our future potential. And the problem is, of course, that since parapsychology is not taken too seriously by most psychologists, these things have not sunk in. But I believe that as time goes by and as the research improves and all that, this will fundamentally may change psychology. And it even starts getting us into thinking, is there something that is beyond materialism? And that brings me to one of my last slides, which is that traditionally the whole field of psychic phenomena has been associated with ideas of non-physicality. Plainly put, ideas of spirituality. Is there a spirit inside each of us? Is the mind independent from the body? A lot of these theories, have been discussing these things. Frederick Myers in the old days, more recently, J.B. Rhine. In a lot of J.B. Rhine's book, and you associate J.B. Rhine only with dry card testing and the like, but read his books, things like The Reach of the Mind, The New World of the Mind, important books by Ryan, he's discussing the whole concept of non-physicality, basically saying ESP and psychokinesis show that there is a non-physical component in human beings. And then, of course, if we accept that, what are the implications of those things for our conception of human beings, for behavior, and so forth? And the whole idea of survival of bodily death is very much involved there. That was so much a part of early psychical research and is still around with us. Cases of reincarnation, mediumship, apparitions, all of those things that have been and are still studied in relation to the concept of survival of death. This is another thing that I think parapsychology can contribute to psychology. An empirical approach to all these problems that have been generally left on a philosophical level that is basically, non-empirical, just arguments going back and forth about the mind and the spirit and so forth. But if these phenomena indicate something else, that is a very important contribution. And for only that, that's why more research is needed to clarify the things that we really do not know. So this brings me basically to a close. I have argued that history shows many common factors in the developments of both psychology and parapsychology, that there are many empirical studies that show that psychic phenomena are related to psychological variables. I would say that 80% of parapsychological research has been about that. And it's still continuing, and we're still learning more and more. Some people get more into theories, and I think Christine Simmons Moore, in her presentation, is going to get a little into what are some of the theoretical models from cognitive and personality psychology that may say something about those relationships. Then there is the whole idea that our view of what are human experiences can be expanded because of parapsychology, the enlargement of our human potential, and of the possibility that we have these forms of communications that science does not accept completely, and that may have implications against the materialistic paradigm. I think all those are very important points to consider. They all, of course, depend on how much validity do you place on parapsychological findings. And that's why a lot of these things have not had, I think, a wide impact. As long as psychology continues in general as a block to be skeptical, the points I have discussed here will not have much impact. And it's only among us that are in parapsychology that believe and take these things seriously. We see the clear implications, but the outside psychology world is very close to it, because they're still dealing with the fact that no, is the thing real? I don't think it is. And as long as you stay there, it's very easy to deny all the other possible implications. And there is some merit to that, but I think there is more than enough evidence to take seriously some of these implications, and then start asking, what can psychology do to implement them, to change the field, and more important, to put them into use, in the clinical aspect, in dealing with behavior in general, to help people to increase our human potential. And that, of course, is a question for the future. But anyhow, this is just a general introduction for the coming lectures. I think some of these topics are going to be discussed by the other speakers. But at this point, I should stop, because I think I have gone a little too long. And if you have any questions, I guess this will be the moment. Thank you.
So thank you very much, Carlos, for this talk. This was fantastic. If you have any questions, please put them in the chat. I know...
I just turned the volume up a little.
Oh, good. I know Allison had a really good one. Oh, here it is. Allison is saying, I'm curious about some of the terms used in the past since I'm currently reading lots of literature from the 19th century. What would be today's term for somnambulism?
Well, it depends how you use somnambulism. Traditionally, somnambulism started being used, and that was even before the 19th century, for sleepwalking. You know, people that would just get up their beds and walk in the room or even go outside and do all kinds of things. There are many records of people that will perform, you know, math problems, writing, and even trance speaking during that that state. Later on, with the rise of the movement of mesmerism, somnambulism was used to indicate an altered state that was produced, kind of like a trance state that was produced on people that were mesmerized. And what that later became part of hypnosis, the hypnosis movement that came just after animal magnetism period, the mesmeric period. That's a whole different aspect of history. But again, somnambulism is still used today in psychiatry and psychology to refer to sleepwalking. I don't know if that will answer your question, or how what do you have found that you found confusing.
Allison followed up and said, I understand it's an altered state, perhaps trance, we call trance a hypnotic state today, but is its relationship to psi being studied today?
Not from the point of view of sleepwalking. You know, the somnambulism that is considered basically a disturbance and a problem basically to be cured. I'm not up so up to that literature, but I know that there are a lot of drug therapies and other approaches to try to stop people from sleepwalking. From the point of view of alteration of consciousness, the closest that you have today is probably hypnosis, that you know you will induce what people used to call a somnambulistic state, and that a few people are studying it today. But from the point of view of people that do sleepwalking, I don't know of anyone that is studying that. At one point, I published a short paper once on an analysis that I did. I had a question in a survey that I asked people that, you know, have you ever been told that you walk in your sleep and talk and do things? And I found that those people that said yes to that had more ESP experiences and the like than others that did not have sleepwalking. In modern times, that's the only thing that I know that has been related to that idea of somnambulism. But you know, that's an area that could be investigated. Again, I don't know that much about the current literature of somnambulism. There is a lot of people that specialize in it, and it has become a very physiologically oriented discipline.
Teresa is saying, I'll have to look into that more. My mom is a somnambulist and has had quite a few psi experiences.
Yeah, I will not be surprised that there is a relationship there, and that's certainly one of these topics that needs more exploration. Remember, there's so few people interested in researching psychic phenomena that there are hundreds and hundreds of topics that have never been touched or have been done just here and there, and it's a completely open field.
We used to, when the Rhine Center used to have the summer study program, we would have visiting scholars. And one year it was William Broad, and one of the comments that was made to him was, "Oh my God, you do such a programmatic over your life. You've done such a programmatic look at the areas of which you're interested in. You haven't jumped around, you know, from topic to topic." And he was saying that he was just more able to ignore the temptation to do a lot of things, and that's a real a real problem in the field when you have so few people doing the research and so many things that are important and would be helpful to be investigating. Everybody kind of gets like, oh, I want to go over there now. So it's kind of hard to keep to a single kind of line of research when there's so much to do. Anita is saying, great overview, Carlos. Curious how much, excuse me, of psi and parapsy can be linked directly to physical experiences. You mentioned in ESP 68% of dreams can be interpreted literally. Is there a percentage of how much dreams are ESP and how much they are something else? Is this the same type of study?
Well, yes, there are a few surveys that have specific percents about what they believe are ESP-based dreams. The issue is that with the survey methodology, there is no follow-up of the cases. So, there's never complete assurance that when they tell you, 70%, that you can be completely sure that these are real ESP experiences, because you are making your analysis based on a questionnaire where people answer saying, yes, I have had dreams about the future, for example. And they just say yes. And most of these surveys don't even have a description of the experience. So, there can be mistakes, people misinterpreting the question, or people thinking that they really got ESP experiences and they really had the information in a conventional way and it came out in a dream. The surveys don't allow us to be precise about it. That's why it's so important also to do experiments. You have people in the lab in which you control, the type of thing that you want, the idea that you want to send to them so that it's not ambiguous, and you separate people. You control the variables to account for the conventional explanations. But when in the surveys, we can never be sure completely about the meaning of those percents. The thing is that they seem to be very consistent and fairly high, and that leads us to believe that these experiences are happening to a lot of people. And when you talk around to many individuals, you always find good descriptions of things that sound like real ESP. But certainly there's more room for investigation in this area, like in everything in this field. It's also a question of resources. If you want to do a study of many cases, you need to have the resources also to follow them up, to get clarifying information. And that is extremely difficult. Even to follow up 15, 20 cases, that could take you a few months to make the appointments, meet the people, talk to them, blah, blah, blah. Imagine how difficult it is when you have 800 persons answering your questionnaire. You could be 2-3 years making appointments, going to meet people, talking to them, and so forth. So it's a lot of time, resources, money. That's why these things, are not done. And the thing is, the survey has certain advantages, high numbers. It at least tells you what the experiences people are having, not necessarily about the nature of the experiences, but you just have to always keep in mind that there is ambiguity in some of the methods. And the surveys have those problems. The experiment, of course, has some other problems. You're not sure if things can be generalized outside of the laboratory and so forth, but you have more assurance that whatever the person was saying is ESP, because everything has been manipulated to control the other variables. I think that's the importance of doing different methodologies and then try to compare the results and see what we end with.
Yeah, I think that's so important that every type of research has a particular type of contribution to make to the overall picture, to the overall narrative. And it's not only is it important for there to be a multidisciplinary, interdisciplinary kind of look at the phenomena and the experiences and the belief and all that kind of stuff, but also within individual disciplines, like within those of us who are psychologists, research psychologists or whatever, to try and be aware of the limitations and advantages of the different types of methods of approaching the questions, and then making sure that the ground in the field as a whole is supportive of all that, because you really need to come at everything from so many points of view to really get the whole picture. So I think that's important. So Morgan was saying, I was rereading information on the cult of Dionysus in Greece because it was considered a study in hysteria, but also in psi experiences. It's interesting to read about it from that perspective. That really is.
Yeah, no, that's true. I think that's an area that I would like to see a lot more studies. You know, these cult experiences that involve alteration of consciousness, particularly those that are collective. It's not only one individual, but you have a group of people that are dancing or chanting or doing things. And the question is, you know, how to really observe the psychic element, how to. I think there are ways, you know, like anthropologists have been involved in studies of this sort for generations, and they have their own methods of blending in the culture and trying not to affect the group too much. I mean, you always affected if you are there, you know, but I think there is a lot more to do and see how much, you know, we can really learn. But because for some people that's very difficult, and it's very hard to control variables. And if you are very high into controlling all variables, I think that's not for you. You have to be more flexible and allowing more different, you know, qualitative observational methods. But certainly I think a lot more could be done, and that's a fascinating idea, dealing with cults like that.
I just realized that I don't know exactly how to get the chat out of here, but what I will do is I will pull all of the links out of the chat so that everybody's got those, and I'll put them up in the classroom underneath Carlos's in Carlos's scheduled section on the schedule. Whoops, I'm losing something that Morgan said. Oh, she's her follow-up here was wait a minute. Was it yeah, it was the first time that exorcism was actually banned in Greece because it became so prevalent. Of course, they immediately thought that was the cause, because there everything, including a cold, was possession. That's true of a lot of cultures, I would think.
Yeah, the whole thing about possession is a very cultural issue, you know, and I think we tend to think of possession as a very negative thing, but many other cultures see possession as a positive event. The high spiritual value is not only, you know, demonic possession like you see in The Exorcist. That certainly looks frightening and ugly, but a lot of you know, anthropologists have been studying spirit possession and other forms of possession for many years, and they believe that those things have even specific social functions in particular cultures. You know, they help with your beliefs, they have to regulate behavior, and then they have all kinds of other things that they see as positive, not as pathological events.
Sorry, I was just adding some extra time to the course. Morgan is saying many cultures, absolutely many cultures, it's seen as a symbol of high spirituality. You have 2 more slides here, Carlos. I know the last one is your montage, but what's on slide 32? I've forgotten.
32?
Yeah, you're on 30. You were on 30. Well, now you're back to 30, but one more over. Oh, these are your bibliography.
Oh, yeah, this was a bibliography. I forgot. You had to memorize this bibliography. There will be a quiz later. and I'm taking it out of sight now.
The PowerPoint is already up in the content library, so it'll be in the course room as soon as we get finished here. And all of the links are, copyable, so you won't have any problems there. Is there anything else that you wanted to say, Carlos?
No, that's it. I just wanted to provide a very general introduction. I will hope that a lot of the details will be filled later by Christine Simmons, by Claudia Massico, by Renaud Evrard. A lot of things we have been talking about history, about clinical, about alter states. Edsel Cardenia will cover them. You will get a lot of the detail that I did not give in this presentation. I was just, trying to give a general intro and to make the point of what I think are the contributions that psychology has been making to psychology for many years. I think that's important to keep in mind, and it reminds us of the importance of our research.
It does. It's so true. I put in one of my stories and one of your stories about Morgan had been making the point in the chat that some of these folks in psychology and other areas who are negative about our field can be bullies. And I think there's so many really good people who come into the field and then find that they have to go out again, or set it aside for when they retire because they can't really afford to have a family or live a normal life or move up in their other subspecialty in psychology. And those of us who are able to keep ourselves going in the field, and thanks to Parapsychology Foundation for that, for us, and other folks that we work for, like University of Virginia and so on, it's difficult to sustain yourself in this area, because of the pressure against doing this type of work, even when you're kind of, orders of magnitude away from that question of whether or not the phenomena is real. So even historians get a lot of negative feedback about doing this kind of thing or being interested. If any of you have read the book, which I think is on Carlos's list, by Moscoff and McBow, called Elusive Science, which was a deep dive, historical of science dive into okay, not there, but not to worry.
It was in a previous list. Yeah.
I am going to be putting up that intro bibliography to the field as a whole that we've been putting up as research in previous courses. I'll be putting that back up into the schedule for this one as well. In any case, what I was going to say was they spent a lot of time interviewing all of the then living past researchers from the Rhine and going through all of the materials and the archives at Duke University and so on. And they came up with a very deep picture of Rhine's work from the 1920s through about the 1940s, and wrote a book that was clearly about this point in time in the history of science. And they got trouble from historians for having picked such a non-consequential, out there sort of a topic. And they got trouble from parapsychologists who were mad at them for not saying somewhere in the book that, yes, ESP is real, PK is real. So there was this kind of clash of agendas in terms of how the book was received, but there was also this commonality of experience that if you got involved, especially in those days, the 70s and 80s, and looking at these materials, that was considered to be not the proper narrative of science. And the good news is that over the last 30 years or so, history of science has started to think more about all of these other things that important people were doing. Isaac Newton was very interested in biblical exegesis and other kinds of topics that people like to put aside as his occult leanings. He was interested. I've forgotten that he was interested in alchemy.
In alchemy.
Yeah, and historians of science are also looking at the people around the scientists. It wasn't just Charcot who did stuff. It wasn't just Lavoisier who did stuff. It was their families who were involved. It wasn't Darwin only. It was Covington, his servant, who made all the preparations and, put together all of the things that he picked up, and maybe even did some of that taxidermy of the plants he brought back from the voyage of the Beagle. That was the foundation of his idea of evolution. So there's this wider view, and I think both Andreas Summers and Claude Massicotte will show how some of these deep dives from a historic point of view or a literary criticism point of view are more possible now than they were then, although there have been very good looks at all of this stuff along the way, like Anne Braudy's book on mediumship in America, and Alex Owen's book on the lunatic laws and mediumship and spiritualism in the UK, and so on. So there's been a lot of stuff over the time in between that have taken these other kinds of points of view. Even anthropologists have gotten stick for being interested in the phenomena itself. But things are changing. People are getting a wider view of how this story can be constructed and what's important. I think science studies has had a lot to do with that. Those are sociologists, anthropologists, and philosophers who have looked at the construction of science and how messy it is compared to the old great man view of history. So that opens up avenues, actually, for keeping the conversation going about the phenomena in the field and its importance in the wider world of science as well. Not that it's making life easier in terms of finding jobs and keeping jobs, but it certainly is a bit better. I have a university position in an online university, and whenever I'm a little nervous about putting a parapsychological publication on my list of things that I've done this year, my dean and the department chair always comes back and says, no, we have a lot of people that are in transpersonal and they're kind of off in that area too, and it's okay. So hopefully that's true.
That's something to ask when Andreas Sommer does this presentation, because he has really specialized in analyzing the whole recent historical, right? He's a professional historian. He has specialized in analyzing recent historical accounts of not only in psychology but in other areas of people that deal with things like mesmerism, hypnosis, and psychic phenomena are involved, and he's very critical of historians that bias their histories because they start saying, well, of course this is nonsense, but I'm going to discuss it because it's interesting. He has a lot of examples like saying that how views like that already bias the history that you are writing and lead you to selecting specific things because of the negativity that you are bringing into the topic. And he finds many examples of that, people that write about mesmerism, about psychical research, about magic in the Middle Ages, and so forth. Well, he will be a good one to ask him about recent trends and how does he feels. And he specializes in American and European psychology. And certainly there are a lot of examples like that. And William James is a great example. People have been writing about William James and are still writing, all of the time. There is even a very recent book about William James and psychic phenomena. And that's a book that some people, including Andreas, have criticized, like basically saying that they are still using their prejudice to analyze James's view on the topic. And it's very difficult to basically live the way you think, especially if you think that these things are nonsense and that they just cannot exist and do not exist. to leave that outside of your historical analysis is very difficult. But he has written about that, and it will be a good person to ask for a summary, or what's the state of the art and what needs to be done and what's happening in that field.
Yeah, we there's an excellent group of responses to an article that was in the American Psychologist, published by Reber and Alcock. And Alcock, you might remember, wrote a book about the field and has been a very forceful critic of parapsychology for many years and is a clinical psychologist. And Brian Williams wrote a very good one that's also included in the new Advances in Parapsychological Research, Volume 10, which is getting really close to being out. We're not sure how long it's going to take, but we're almost there. And there were a number of other people who also commented on this response, because what happened was Edsel Cardania published an article that was a positive overview of the history of the field, of the history of experimental research in the field, and the level of its significance. And then these two skeptics came along and said, forget the evidence. It's just impossible, period, end. And American Psychologist, which is supposed to be the flagship of the American Psychological Association in terms of journal, published that. So for them, an ontological argument was just fine. We could just come up and say, forget the evidence, it's all impossible. So it's still quite different in that way. I wanted to go back because Anita is saying it's hard to imagine our evolution to here without ESP or parapsych from observing history, dreams in the Bible, emperors consulting mystics. This topic, and relevant. And then Morgan is saying, I think that if people are leaving it out of their analysis, they're basically editing history with an agenda at that point. And that's, and Lisette said that's intellectual dishonesty. It's absolutely an unfortunate kind of thing. I mean, that term, the enchanted boundary, which was the title of a book back in the day, is this notion that you could have a William James or a Charles Darwin or an Isaac Newton or somebody who had this body of solid science, and as soon as they went over the line and said, oh, there might be something to this psychic stuff, the notion was that they lost their mind at that moment. They've gone over the enchanted boundary and they've been completely brainwashed by this wild idea, and isn't that too bad? So when we memorialize that person's life and work, we'll just be nice to that guy and leave that stuff out. And I think that's, as everybody was saying, and as Carlos was saying, that's a shame. And it's yeah, as Lisette says, they're forgiven for their indiscretion. Exactly right. I think it's a shame that that's done, and hopefully it's being done less, but those are good questions for Andreas. Yeah, that's the other thing Morgan was saying, and what these types of approaches discount is that science and parapsychology is continuing to expand. So eliminating that history at this point damages future analysis of the human experience. That's very well put. I think that's also very true. Well, I'm going to go back over to our other PowerPoint and pop over. So does anybody else have any other questions or comments that you want to make? Now's the time. And if not, I will let you know what's happening next week. O'Brien is saying, one wonders whether that kind of thing happened to Alfred Russel Wallace in the tendency for his lesser recognition of his contributions to evolutionary theory.
Yeah, I think Wallace suffered from that. Certainly, there were plenty of people that were putting him down because of his interest in spiritualism, and he came out and he defended the phenomena, and he defended all kinds of phenomena, like physical mediumship, materializations, all kinds of things that were very difficult to accept for a lot of people. And he tended to be put as an uncritical guy, And certainly there were times where he could have been more critical here and there, but just because he had an interest And just because he took the thing seriously, it really should not have been an element. But I think that was part of why he was kind of marginalized from science, and more credit went to Darwin. I mean, Darwin was interested in spiritualism, but he didn't come out like Wallace did. I mean, Wallace wrote in some of the most important reviews in England. He has. I was recently seeing an article of his in the Fortnightly Review, a defense of spiritualism. And he's very strong and very direct. The guy was a clear writer, and he said what he really believed. But I think he paid for it. The same happened to Charles Richet. I did not include that much, just very briefly in my book about Richet. But Richet suffered greatly from his involvement in psychical research, particularly from his endorsement of a series of seances of materialization phenomena that took place in the early 1900s. A lot of people are writing, even in newspapers. I have found some of those references, and there were people that were basically saying, "Oh yeah, Richet is a good scientist and all that, but he loses his objectivity when he comes to this topic. He got involved, and his mind became pathologized with the whole negativity and pathology of the seance, blah, blah, blah." They were discounting him completely. And, and then this was a man that was considered brilliant in everything that he did, that won a Nobel Prize. There was even an incident of someone, there are many of the telegrams and letters that he received when he got the Nobel Prize. And there is one, and I forget now who it was that sent it, but he said something like, "Oh yeah, this is well deserved, very important work." But then he felt bound to say, with the exception of that foray that you did into spiritualism or something, that was almost like saying, "Yeah, you are great, you deserve the prize, but there is a stain in your personal record that you were involved and you defended it." And he defended it at the time in the early 1900s, and still when he was writing about that in the 1920s, he still was going out and saying, "No, I believe what I saw, because it was a figure that appeared, and it will disappear on the floor, and it will walk around." And I mean, it's stuff that is difficult to accept, because it was really what people call macro, really big phenomena. But the way he was treated, I think he was able to survive that because of his eminence. He was so eminent as a scientist, and he moved in high elite circles. Then he was also rich. He has personal fortune, and he was of very high French society. So that didn't shield him from all this stuff, because in the press, he will be called names and that he was duped and all that. But his career did not suffer, because he was really so high up, But if he had been more of a normal scientist, he had been someone, like me, for example, they will have destroyed the guy, and he will have lost his position at the university and all kinds of things, He was lucky he had proper social scientific shields to cover him up, but the usual person involved in psychical research, and I think Wallace also had some of that, but certainly a lot of them, and not to mention William Crookes. Mm-hmm. If you get into the stuff behind, not only behind, because Crookes discussed those things openly, people were questioning his training and his scientific contributions, instead of just analyzing the experiments he did with the medium Didi Hume, which were the things that brought all the controversy. They were saying, this guy, William Carpenter, one of these critics, was basically questioning his competence as a scientist. and try to put him down, like saying, well, after all, he's not such a great scientist. Things like that. And and of course, Crookes was a good writer and was not shy. So he answered all of that, and I think very well. But he must have suffered a lot in the process, and it's a common pattern that we see that people get so negative that they just think that they have permission to discredit someone even outside of the realm of discussion, not in the seance room where the thing happening, not what happened there, but even getting into the personal life of the guy and trying to find something to put him down. And it's a shame, but I think those things are still happening today.
Yeah, definitely. And I think it's a testament to William James as well, because there was a lot to have to put aside for his father was a Swedenborgian. He grew up in a family that was very open to these phenomena. They weren't super rich. He had a couple of brothers who were, wended their normal way. I think not only was his reputation huge at the time that he was working and living, but his brother was also, Henry James was also an enormous novelist who was well known and so on. So there was, and they certainly had social connections in the, quote unquote, better society in Boston. So, and there's literally an industry in history of science and history of psychology on James's life and work, and ever a very active part of his life mentioned. And I think that's that notion that they can just put it aside. Morgan was saying the skeptics that she's talked to have had a difficulty with the non-physical. And later, she said, let me go up a little bit. She finds many of the people have a hard time grasping the physical world around them. When you begin to look at their personal lives, they're struggling to keep on top of things. And I think that being asked to accept that there's something non-physical is just too much. And I would imagine that's true. Oh, Allison, thank you for that. Thank you for the that link on Henry James. It's fascinating and it's difficult to deal with, because there's so many barriers still to these conversations, but it's better, I think, than it was before. I mean, you take a look at some of the people that are coming up over in the UK that are getting their PhDs with research that's focused on psychical research and psychic phenomena, and they're doing better than a lot of the people in my generation have done in terms of integrating themselves into normal academia. But it's not perfect. I mean, there's been a big backlash in the UK. Bob Morris opened a lot of doors, and after he passed, some of those doors started to close. And the graduate students of today in many of the countries that where this work is being done are still being told, get yourself something else as a specialty as well, so you can publish in the regular literature as well as in psychical research or parapsychology. In order to protect your ability to get a job. So there's still this kind of a skeptical soup that has an impact on the practicalities of life as well. Anita is saying that she agrees with Morgan that she feels the invisible can make a case on an equal level than other concepts sharing non-physical space like law or remuneration, health. So I think it's complex is what it is. Seriously complex, not only intellectually, scientifically, academically, in a scholarly sense, but also in a social sense. And you can just hope that advances that are being made in different disciplines are going to open doors farther and give us a better standing for the future, for the experiencers, for the investigators, for the academicians, and so on. All of us back in the 1980s, we all thought was going to happen, you know, before we got to be 40. We were all going to be tenured and no problem. And clearly not. So somebody else's, as Louisa Ryan said at the end of her life, well, now it's time for somebody else's 50 years. So maybe 100. We'll see where we end up. Well, thank you guys for all your conversations and all your comments and all the links and all that stuff. This has been a wonderful discussion. And thank you, Carlos, as always, for
Thank you.
putting together a really excellent presentation, which, as always, has stuff in it I've never heard before. So let's thank you very much again. Thank you, Carlos. Thank you, everybody in the chat. Thank you for your links. And we'll see you next week.